Hey everybody, this is Kevin McFarland from The Art of Emergency Nursing, and you're listening to 30 Days to Being a Badass ER Nurse. In the next 30 days, I'm going to give you some quick tips and tricks to help you be a better ER nurse. And of course, as always, it's not just me you're going to hear from. I've recruited some of my friends to give you some of their tips and tricks so they can share their knowledge as well. So don't forget to subscribe so that you catch all the episodes. And if you find one of these tips and tricks are really helpful, give me a shout out on social media and share it with your friends. Let's get into today's tip. Hey everybody, welcome to day 27 of the 30-day podcast challenge, 30 days to being a badass ER nurse. I want to tell you a quick story about a patient I took care of once. She was about 50-ish year old woman who was there for shortness of breath. She had a combination of asthma and emphysema. And I'll never forget that when she first came in, she was super, super sick. We gave her a few nibs and she started to look a little bit better. And sure enough, before you knew it, the doctor said she was ready to go home. Well, I wasn't sure she was ready to go home. I wasn't convinced. And what I did was what I shouldn't have done, and that's not say anything. I just assumed that the doctor knew better than I did, and I went ahead and discharged the patient. About 2 hours later, the patient came back, this time by ambulance, and she was even sicker than she was before. She ended up getting intubated, ended up getting admitted. And while I wasn't her nurse that time, I still remember to this day thinking to myself that I should have maybe kept her, and maybe she wasn't quite ready to go home. Obviously, she wasn't. But I never said anything, and that was one of the things I always regretted. So maybe the advice I needed to hear is the advice you're going to get ready to hear from my friend Cheryl Randolph. She's going to share some advice about advocating for your patient. Take a listen.
Whoa. And this is making you a badass? Okay, here's the badass. Don't be afraid to be unpopular. If you know something is true and right and good and you need to sleep at night, then stand up for what you believe in. If it's the patient's advocacy, if it's something the patient needs, if it's some test or diagnostic, or maybe it's a consult, talk to your doctors. I know we're nurses. Nurses don't order things. I know that. We don't order drugs and meds and consults and such. But we have what's called a collaborative practice. That means that you talk with your doctors, you say, here's what I see going on. I'm in this guy's room all the time, and I see X, Y, and Z. Have we thought about these other factors? Have we thought about any other tests? What do you think's going on? And don't be afraid to brainstorm with your doctors about what the patient needs. And sometimes it's not going to be, your point of view might not be a popular one. Maybe your point of view might not be the diagnostically correct one, quite frankly. I mean, everyone's still kind of learning in the ER. But there are going to be times in your career when you're going to see something, notice something, perceive something that your doctor is not going to perceive, and that you're telling the doctor or the team that's taking care of that patient about your perceptions, about your assessments, is going to make a big difference and is going to turn the whole game around. So don't be afraid to be the unpopular one. Don't be afraid to come out with information that maybe no one else has. And don't be afraid to advocate for what you see as the needs of the patient. And it's hard. You're not always going to be loved for this. Years ago, I had a patient that in ICU who was doing absolutely horrible on the vent and just having a really bad time. I thought he needed to be bronched. I called my doctor, pulmonologist, and he disagreed with me, did not want to come in to take care of the patient, did not want to come in to see the patient. I wound up calling another doctor and having him come in to take a look at the patient. He said the patient was in distress. He wound up bronching him. Patient got a lot better. But for every day following that, the original doctor, whenever he saw me, he would literally turn up his nose and make a point of walking in the other direction while making a horrible noise. But you know what? I could sleep at night knowing I did the right thing, knowing I stood up for what the patient needed at that time. So sometimes it's not always the easiest thing to do, but you're the one who's there. You're the one that's seeing things, perceiving things that perhaps the doctor is not. It's a collaborative practice. It's a team sport. You got to all be in it together.
Thanks, Cheryl, for that great tip. Always remember to advocate for your patients. You are the eyes and ears of your doctor, and you're a trusted member of the patient care team. So you always have to advocate for your patient and always speak up if you ever think that maybe your patient is doing something different that your doctor may not be realizing. That's one of the things you will absolutely never in your career regret. And remember that the doctor has their practice and you're responsible for your own. So you're always responsible for what you do and what you and how you advocate. So it's critical that you do that. I hope you enjoyed this post from Cheryl. You're going to hear more from her here in a few weeks when I post her full episode. Until then, I hope this tip serves you well. Have a great shift.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.